So what we assess first is the movement of the SI joints in the sacral area. So I poke side to side, I check the motion mobility of those joints. So for here, the left side is tighter, so I pop it up and do a couple drops on it here to get it more mobile and just up in there. And then we're gonna work on the glutes on both sides, specifically up here piriformis muscle, because as the belly goes out in the front, naturally the glutes tighten up just because of that weight change. So we're gonna bend here, we're gonna do one side at a time, and just stretch in and out here. Is that okay, pressure?
Mm-hmm.
And we're gonna assess the sacrotuberous ligament. So I'm gonna find the bottom of that tailbone and push one side at a time. Either side tender at all?
Yeah.
Which side?
Oh, the left side.
You're fine. So both sides feel a little tight, so I'm just gonna hold them one side at a time here. I'm gonna slide up your hips here. Don't push all the way up. Baby's right there.
Yeah.
That's why. Slide towards me. And here we're gonna get the lower back and SI joints moving more, so nice and gentle here. And there we go. All right. There you go. On your back here. The pubic bone in the front, so we feel down to the bottom of it, and I'm gonna push one side at a time and feel the motion of both sides there. And I'm gonna use a little activator to loosen it up in here. And now we're gonna stretch the hip flexors one side at a time. So I'm gonna just apply a little pressure and move that hip around here. So Webster Technique is technically only the round ligaments, but I'm going to do a full belly massage in here. I will start with the round ligaments. Just poke around and see if I feel any tightness, ropiness. Right there's a little tight. Kind of get it to self-release. Same on this side. Up and down to the middle.
What actually is Webster Technique? So I've done a lot of videos with pregnancy and prenatal care. You've seen me talk about it. And basically, Webster Technique is a specific technique for pregnant patients. So our main goal with this technique is to prepare your body for labor. So in order to do so, we are going to focus on 2 bones, 2 muscles, and 2 ligaments. 3 are going to be on the front of the pelvis and 3 are on the back of the pelvis. So I've kind of differentiated them. So P stands for posterior, so that means it's going to be on the back of the pelvis, and A stands for anterior, so it's going to be on the front. So the first bone that we work on is called your sacrum. So you can see it's a triangle in shape, and this is what a lot of people call your tailbone area. So again, as you can see, this is your pelvis, and this is kind of how it sits in our body. So when it comes time for the pelvis to open, the sacrum in this kind of bowl shape needs to open up nicely so that baby has plenty of room to go through. So we really want to make sure that this bone in particular is opening really nicely. In my opinion, this is the most important out of all of these as far as when you go into labor. This bone moves in so many different ways and can get stuck very easily, and it's one that when it comes time for labor, you want it to open up nicely, because a lot of the times babies' heads can get stuck on the sacrum and coccyx, and that's why they can get like bruising on their head and stuff like that, because it's not opening fully. Now from the front, we deal with the pubic bone. So here's our pubic bone. So those of you who have been adjusted by me for Webster's know that this area is typically very, very tender. The reason for that is as our bellies grow, it's a lot more stress put on that front of our pubic bone that we don't normally have. So we got to get this moving again, so when it comes time for labor, everything opens nicely. It's not a very big joint, but if it's not moving properly, again, when it comes time for our pelvis to open nicely, it's not going to have that full opening. So this can increase labor time. If your baby happens to be breech, it'll decrease the space that baby has in order to want to turn around. So it can do a lot as far as not letting that pelvis open and giving baby enough room. Now, with the 2 muscles, 2 ligaments, they're kind of similar in the fact that they all attach to different parts of the pelvis, and if they're pulling and they're tight, again, when it wants to open, it's not going to fully open. So from the posterior aspect, or the back of the pelvis, we work on a muscle called your piriformis. So it's a muscle in your glutes that it's very small, but it can wreak havoc on the body. So you've probably seen that a lot of the times pregnant women can have issues with sciatic pain. So this is the muscle that can push on your sciatic nerve, causing pain down the leg. It can also pull on your sacrum because it attaches there. And if it's not relaxed, then again, it's going to pull and your sacrum's not going to move like you want it to. Now from the front, we work on your psoas muscle. So this muscle is a little different because it actually starts in our low back and then comes around to the front of our hip. So it can kind of shift our body a lot, and we want this moving fully, so when it comes time to open, everything opens nicely. Now the 2 ligaments we work on. From the back, we work on what we call our sacrotuberous ligament. So this ligament goes from our sacrum to our outside bone called our ilium on our pelvis. So again, same concept. If it's tight, it's going to pull on that pelvis and that sacrum. The other ligament we work on is your round ligament. So this is a ligament in the front of our pelvis. It actually goes from our pelvic wall to our uterus. So a lot of the times I'll have some patients say that they have round ligament tightness or ligament pain, because this can actually pull on your entire uterus, causing a lot of discomfort. And this is a lot of the times when you're walking and having that pain kind of in the front of the pelvis, you're going to feel it more around here. So you want to make sure that this is nice and loose. And this is actually one of the ligaments that I'm going to teach you how to relax on your own. So if you do have pain, tightness, or just want to relax it on your own, it's something you can do at home as well. So as far as Webster Technique, these are the 6 main points that we look at. Of course, we look at other parts of the body as well to make sure that nothing's going to interfere with that pelvic motion when it comes time for labor. And we also give you nice easy stretches, exercises, all these different tools that you can do at home to make sure everything stays moving, stays loose. So when it comes time for baby, hopefully labor time's a lot quicker, baby's in perfect position, your pushes are nice and strong. So those are a lot of different things that we focus on. So if you have any questions about the actual Webster Technique, there's lots of research on how effective it is on the internet. You can always give our office a call here and we can give you information there too. So if you have any questions, give us a call. Thank you.